Is splenectomy always necessary for sickle cell splenic sequestration? Imagine a sudden crisis where the spleen, a small organ in your body that helps fight infection, suddenly swells up with blood. This is called splenic sequestration, and it can be life-threatening for people with sickle cell disease. But does this mean surgery to remove the spleen is always the answer? Not necessarily. In many cases, the first step to treat an acute splenic sequestration is to give blood transfusions. These help replace the sickled red blood cells that have pooled in the spleen and restore blood volume. Intravenous fluids may also be used to support blood flow and keep the patient stable. The goal is to reverse the crisis quickly and avoid surgery if possible. Surgery to remove the spleen, called splenectomy, is usually considered only if the person has repeated episodes of sequestration or if the spleen becomes very enlarged and causes ongoing problems. Some children with sickle cell disease naturally experience autosplenectomy, where repeated infarctions cause the spleen to shrink and lose function by around age 5. When this happens, the risk of future sequestration drops significantly. Deciding whether to remove the spleen involves weighing the benefits of preventing future crises against the risks of surgery. These risks include infection, since the spleen plays a key role in fighting bacteria, and surgical complications. Sometimes, doctors may consider partial splenectomy, which removes part of the spleen, to keep some immune function while reducing sequestration risk. Alternatively, some patients are managed with scheduled blood transfusions to keep sickled cells at bay until the spleen naturally loses its function. In summary, initial treatment for splenic sequestration focuses on transfusions and supportive care. Surgery is not always the first choice and is mainly reserved for recurrent episodes or severe spleen enlargement. Many children with sickle cell disease become functionally asplenic naturally, which lowers their risk of future crises. The decision to perform splenectomy is personalized, based on the patient's history and overall health, and should always involve careful consultation with healthcare professionals experienced in sickle cell management. This approach ensures that treatment is tailored to each individual's needs, balancing the benefits and risks of surgery while prioritizing safety and quality of life.